So our next talk is going to be on how stress alters immune responses during respiratory infection. Our speaker is Dr. Philip Griebel from the University of Saskatchewan. Dr. Griebel is a research fellow at the Vaccine and Infectious Disease Organization, abbreviated as VIDO. He is professor in the School of Public Health at the University of Saskatchewan in Canada. He's graduated with a bachelor's degree in cell biology in '77. He obtained his DVM from the Western College of Veterinary Medicine in 1981, completed his PhD in immunology in 1988. He's been very active in research related to mucosal immunity and vaccines for over 25 years. And he is currently interested in development of the mucosal immune system in newborn calves and optimizing vaccine strategies to prevent respiratory disease during critical transition periods such as weaning. So please welcome Dr. Griebel.
Thank you. Thanks, Laurel. It's a real pleasure to be here. It's been almost 6 years since I talked to the ABC about stress, and it's a pleasure to come back and start to tell you a little bit about the progress we've made. And I just wanted to start with this picture, which it was very nice at the discussion at the last session, where it came down to how important that relationship is between people and animals. And that really is, when we start talking about stress, we're starting to talk about how we relate to animals, since we're the ones who impose change on them, and that's really what stress is about. And so I'm going to just start talking a little bit about stressors that may be associated with BRD, and then try to show you some of the evidence that we've accumulated about how important stress is in actually impacting mortality and immune responses. And then some of our more recent studies where we started to ask the question, how important are individual or specific stressors in altering these immune responses? I think the comment earlier today is that when we have multiple stressors, that they may be additive. And that's not really what we're seeing. And then just to show you that modifying, that we can then go in specific ways, modify stress, and then alter immune responses. So there are ways that we can change the outcome. So if we look at what happens, and this is for beef calves, they've spent 5 to 6 months establishing a very strong relationship with their mother that's both psychological and nutritional based. And in the industry, we suddenly disrupt that bond. We take these calves, separate them from the mother, and then put them on the truck, and we start a whole process of change for these calves. And each of these changes may actually be considered a stressor. The dietary change, the transport, which many other groups have looked at and shown that one of the major mediators of stress, cortisol, is significantly elevated. When these calves then arrive at the feedlot, they undergo restraint running through the chute for vaccines or antibiotics or growth promotants. And again, many groups have looked at this and shown that restraint, even for 10 to 15 minutes, can be a significant stressor. And as has been mentioned, we then, if these cattle are multi-source, put them through a social reorganization and then place them in a new environment where they have to find feed and water. And so you can see there's a large number of potential stressors, and there's another component to this, which is time. And you'll see the models that we use, that each of these components may go on for a variable amount of time. So there is the potential for additive or synergistic effects. And our model, and a lot of people have used the word stress, and it's been very poorly defined. And so one of our objectives in our studies was to start creating defined stressors and to look at the impact of those on bovine respiratory disease. And so the model that we've developed is that we actually go out to a ranch and we select calves at the ranch. doing serological survey, so we know these calves have no maternal antibody or prior exposure to the respiratory pathogen. So we're really working with naive animals, and then we do insert different management procedures. Either we pre-adapt these calves in a variety of ways that I'll talk about, or we abrupt wean, we take them directly off the cow, and then these calves are transported to our research facility and undergo a defined respiratory disease challenge. And throughout all of this, we're collecting a variety of samples to analyze proteins in serum, to look at cell function and gene expression. And after the respiratory challenge, then we monitor clinical responses and again collect samples and try and correlate what we're seeing with these clinical responses. And so this is just summarizing some of the details of our model. Our transport in our system is only 3.5 to 4 hours. If you think about cattle that can travel halfway across the country, that's probably a minimal transport stressor there. Then these calves arrive at our facility, and the next day we then challenge them with a defined pathogen. We use BHV1 or IBR, a virulent isolate that we have with a defined dose, and this is an aerosol challenge, so they're inhaling that into their upper respiratory tract and the lungs. And then after that, we monitor clinical signs, and 4 days later, we then challenge with a virulent strain of Mannheimia hemolytica, again with a defined dose, and we follow those calves and collect our samples, and then at the end of another 6 days later, we terminate, because we know in this model the majority of the animals that are going to succumb to this infection will die within 3 to 5 days. And in this model, usually 40 to 50% of the calves will develop fatal pneumonia. So the first time we ran this trial and we actually introduced stress into it, so what we did is our preconditioning was actually just to take calves that were weaned, transported to our facility 2 weeks prior to the viral challenge, and we compared that to calves that were what we call abrupt wean. They were weaned and placed on the truck on the same day and transported to our facility. And what was quite remarkable for us when we did this study is that we essentially doubled mortality. So going from about 40% mortality in calves that had been preconditioned to 80% mortality. And this was quite a remarkable finding. We were quite surprised that stress could have that much of an impact. So the following year, we repeated the study, partly at the insistence of reviewers, and we saw exactly the same thing again. And while repeating the study, what we did is we asked the question whether this stressor would increase the duration of this period of susceptibility, because we're really looking at a fairly tightly choreographed challenge where we're introducing bacteria 4 days after the viral challenge, and our viral challenge is 1 day after we initiate the stressor. And this time we increased the number of animals from 10 to 20 per group for our preconditioned, and this time we saw 50% mortality in those calves that had had a 2-week preconditioning period, and we saw 90% mortality in the calves that were abrupt weaned and transported. So in essence, in an independent trial, we could repeat this observation. And in this case, what we did, we split the calves, the abrupt weaned calves, into 2 groups, 10 that were challenged with Mannheimia 4 days after BHV1 infection, and 10 that were challenged with Mannheimia 12 days after the BHV1 or IBR challenge. And we picked 12 days because this is a time when the BHV1 infection has been cleared. Calves usually shed the virus for 10 to 12 days. So we wanted to see if the effects of stress would be apparent with the bacterial challenge, even if the viral infection wasn't there. And in fact, what we observed that there was only 1 out of 10 calves that died with the Mannheimia challenge at that time. So it appeared to be very little effect. And our conclusions from these 2 trials is that actually abrupt weaning and transportation stress could have a significant impact on the outcome of bovine respiratory disease. And the other conclusion is that the effect of stress was limited in duration and dependent on viral infection. So that if the virus infection was cleared, then we had very little impact from our bacterial challenge. So then we wanted to start looking at by what mechanisms it was that stress could actually mediate enhanced disease susceptibility. We focused in on innate immune responses because we're looking at mortality due to a secondary bacterial infection, and this mortality is occurring very rapidly within 2 to 3 days after the bacterial challenge. So those are the hallmarks of innate immunity that act within hours to days. And we started, our focus was really in the beginning, we were looking at the response to the virus. So we asked the question whether stress changed the response to the virus, and that was what altered that viral bacterial synergy. And what we know about BHV1 is that it's a very potent inducer of certain cytokines, in particular interferon gamma and interferon alpha. And these are innate immune responses that animals mount in the face of a viral infection because the interferons induce a very potent antiviral effector mechanisms, enzymes that can chew up viral RNA or block viral assembly and release from the cells. And what was surprising to us when we looked and we compared in our abrupt wean versus our preconditioned calves, because everybody had told us that stress suppresses immune responses. In fact, what we observed is in our abrupt wean calves a significant increase in the innate immune response to the virus. So in fact, this stress was enhancing immune responses, and we had a similar level of viral replication. Now with our studies with BHV1, it's very clear that it's a very effective pathogen because although it induces very strong interferon responses, it's very insensitive to the effects, the antiviral effects of interferon. In the last year, we've shown when BHV1 infects calves, induces high levels of interferon, but that virus then shuts down the induction of interferon-induced antiviral responses. So it's a pathogen that activates the innate immune system and then effectively evades it. And what stress does is enhance this activation of innate immunity. And it became even more clear if we then took the calves from these studies and we sorted them based on disease outcome, calves that died versus animals that survived. And here you could see the animals that die, the interferon alpha was significantly higher, and that was even more pronounced for the interferon gamma. So there was an apparent correlation to a greater immune response to the viral infection and a poor response to the bacterial infection. So that's just summarizing that. And that really led to this question, is how could an enhanced innate immune response to viral infection actually enhance or fatal secondary bacterial pneumonia? And many people have suggested that in the face of infection, what we need to do is enhance innate immunity, and that will increase disease resistance. So to look at this in a different way, we did some transcriptional analysis. We started to look at genes that we knew would be involved possibly in the recognition of a bacterial infection. Mannheimia hemolytica is a gram-negative bacteria, and that means that it produces lipopolysaccharide or endotoxin. And we know that there's specific genetically encoded receptors that are very important for the recognition of gram-negative bacteria. And these receptors are specifically CD14 and TLR4. So we looked to see if the expression of these receptors were actually increased in viral infection, and that might explain that if we have an increased capacity to recognize the bacteria, could that have deleterious effects? And in fact, what we found, if we sorted these animals, we looked at the level of expression of the TLR4 receptor, and a lower value here means higher level of expression because we needed fewer cycles of amplification to detect transcript. And so we saw that there was significantly higher TLR4 expression in animals that died, and similarly higher CD14 expression. So how does this really make any sense in terms of response to bacteria? If we look at the receptor for LPS, which is a complex of CD14 and TLR4, if this receptor is activated, it then, through phosphorylation of signaling proteins, activates transcription factors and turns on these pro-inflammatory cytokines, IL-1, IL-8, and TNF. And these are cytokines that are really involved in tissue inflammation, recruitment of neutrophils to the lung, which is one of the hallmarks of Mannheimia infection. And so if we activate that response, it is actually possible that we can have more immunopathology rather than disease protection. And that's exactly what we see. So whenever doing genetic gene expression studies, the question arises whether the increased transcript translates to increased protein and increased cellular responses. So we did function assays, and what we actually saw, if we took peripheral blood mononuclear cells from animals at various days following BHV1 infection, day 0, 2, 4, and then we challenge here with Mannheimia, and day 6. And if we take these PBMCs and we actually expose them to LPS, and then as a readout, quantify the amount of TNF that's secreted by these cells, do we actually see a differential response between animals that survive versus animals that die? And that's exactly what we see here. Beginning on day 2 after BHV1 infection, you start to see a significant rise in the calves, in the calves here, and that becomes very pronounced, more pronounced on day 4. And by day 6, we have, this is 2 days after Mannheimia infection, there's a marked difference between those calves that will die and those that go on to survive. And so at a functional level, it becomes apparent that what we're seeing at a gene expression level may be relevant. So just to summarize then from these studies, what we've found is that that stress actually enhances the interferon gamma response, or the innate immune response to a primary viral infection. And this results in a significantly increased expression of receptors that are very important in the recognition of gram-negative bacteria. And this increased gene expression is associated with a change in functional capacity, an increased capacity to produce pro-inflammatory cytokines such as TNF in response to endotoxin. And what we know from a number of animal models, that TNF is a major mediator of tissue damage and septic shock. So these, when we look at the lungs of these animals that we were looking at, or that were in these studies, we had one conundrum in that the animals that were dying that had been exposed to transport and weaning stress, we were actually seeing less lung damage in these calves because they were dying within 2 to 3 days after bacterial challenge, whereas the preconditioned calves, it usually took about 3 to 5 days before they would die. And so they actually had more lung damage. And in the last year, we've gone back again, repeated this study again, and one of the things that we did is that we cultured not only lung, but we cultured spleen from the calves that died. And actually what we're finding in all the calves that were dying is Mannheimia hemolytica in the spleen. So now what we have is evidence that there may be a systemic infection with Mannheimia, and we actually have a way that that bacteria could be causing a much greater response in terms of immunopathology than what is happening in the lungs. And it was always a comment of our clinical veterinarian when we did these trials that he couldn't understand. He would go out and look at these animals because he, in our animal protocol, was checking them every 3 to 4 hours. He would look at these calves first thing in the morning at 8 or 9 o'clock, and they would look fine, and by the time he came at noon, he would find 2 or 3 of them dead. So they were dying incredibly fast, often not showing severe respiratory distress. So that led us to start asking other questions then, whether the response that we were seeing in these calves was specific to the combined stressors of transport and abrupt weaning, or would individual stressors also be able to modify these responses. And this is a more recent trial that we've completed in the last year, where what we had was our control group, and these were calves that were adapted to weaning and transported to our research facility 2 weeks prior to the BHV1 challenge. These are our pre-adapted calves. Then we had calves that were actually pre-adapted to weaning for 2 weeks at the ranch. So their only stressor was transport, because then the day before challenge, we took these calves, put them on the truck, and brought them to our research facility. So this was a transport stress. This is the group I've been talking about, where we wean them, they come off the cow, go on the truck, and come to our research facility. And then working with Dr. Joe Stuckey, we added one more group to this, where we inserted nose paddles into the calves 4 days prior to transport. So we modified that maternal relationship. It was no longer dependent on nutrition. So these calves are unable to suckle the cow for 4 days prior to removing them from the cow, putting them on the truck, and bringing them to our research facility. And then we had a group that was a baseline, where we had all the stressors but no viral infection. So if we start to compare and ask the question, do individual stressors or combinations of stressors have different effects on the immune response? What we see, if we look at weight loss in these groups, that this is our uninfected group here that is stressed. You can see there's a little bit of weight loss for 3 to 4 days post-weaning, and then they go into a positive weight gain. In contrast to that, here's the group with no stress, pre-adapted for 2 weeks at our research facility, and they show the typical severe decrease in weight that we always see with our BHV1 challenge model. But significantly different from that no stress group is if we look here at the calves, that this surprised us somewhat, where we had the modified weaning process, that in fact they had a bit of a reduced weight loss, as well as this group where we combined abrupt weaning and transport also had a different weight loss. So to us, these differences in weight loss suggested that there were some physiological differences here in this early infection period, although at the end of this, all of these calves had substantial weight loss. There was no difference in temperature amongst all of these calves. They all developed severe fever, as we expect with our BHV1 challenge. What was very interesting here when we looked at viral shedding is that there was one group that stood out, which was the transport group, that on a number of days it had significantly higher virus shedding than when we compared it to the group in red that had no apparent stressors, the pre-adapted group at our research facility. And this is is consistent with some previous work published by Dr. Frank Blecka in the 1980s, where he actually showed that in transport stressed calves, that the serum from those calves could enhance BHV1 infection in vitro. And so here we had some in vivo evidence that transport stress was having a very different effect, or a significantly different effect on virus shedding. If we start to look at some of the immune parameters, and we have these different stressors that we're looking at in these groups again, if we look at interferon gamma production, as we had shown previously, there was a significant increase in this when we looked at the group with abrupt weaning and transport. They're up here. These are the pre-adapted calves. What was surprising is the calves that experienced transport alone had the greatest increase in this response to viral infection. So we start to see that different stressors can actually have different effects, and these aren't necessarily additive effects. So if we put together two stressors, abrupt weaning and transport, we were not having a greater effect than just transport alone. If we look at the overall inflammatory response in these animals using an acute phase protein that we call serum haptoglobin, this protein's interesting to monitor. It's produced by the liver in response to those pro-inflammatory cytokines I mentioned earlier. IL-1, IL-8, IL-6, and also interferon gamma can induce haptoglobin production by the liver. And what was quite surprising, that we saw similar levels of haptoglobin in all of our groups, even the non-stressed group. Even in this group A with very little or no, the pre-adapted group had similar levels of haptoglobin as our other groups. It was just this group where we had modified that maternal separation, where we actually saw a significantly reduced level of pro-inflammatory response. So that it's suggesting, again, that if we actually modify some of these stressors, we can start to modify the inflammatory response. And if we go back to using the assay to look at LPS-induced TNF production, again, there was a marked difference in one particular group. That was our combined stress of abrupt weaning and transport, that's where we saw the greatest increase in response to endotoxin or LPS. So all of these studies are starting to show that stresses are not necessarily additive, that there can be quite specific effects by individual stressors on the innate immune response to either the viral infection or bacterial infection. So to summarize then, what these experiments are starting to tell us, this is intuitive with all of our experience as veterinarians, that these fall weaned calves experience multiple concurrent stressors. But the point I would really like to make that we need to think about is that these stressors may vary in duration, and they may vary in the temporal sequence within which they occur. And that really is the part that we don't understand, is what might be the consequences of changing the duration or the sequence within which these stressors occur. And with our experimental BRD model now, it reveals that there is a temporal relationship between stress and susceptibility to fatal secondary bacterial infection, that the impact of stress occurs within a very defined interval, and if we can modify what's going on during that defined interval, then we may be able to modify the outcome. What we've found is that combining transport and abrupt weaning significantly enhances innate immune responses to a primary BHV1 respiratory infection, and we think it's this increased innate immune response to that viral infection that actually enhances responses to the secondary bacterial infection. A bit surprising for us is that transport alone or combined with weaning has distinct effects on the innate immune responses, that if we looked at transport alone versus this combined transport and abrupt weaning, that transport alone had very different effects. It actually enhanced viral replication, which these combined stressors did not do that. And in terms of dealing with groups of animals where viral transmission from one animal to another may be important, then having a stressor that enhances the level of viral replication and shedding may be very important from the perspective of herd health. And also what was interesting to us is that if we modify that maternal separation process, that we could actually reduce inflammatory responses following BHV1 infection. So this is starting to tell us that if we go in and modify stressors, even psychological stressors, because when we modify the maternal separation process with the paddles, we've eliminated the nutritional bond, but these calves are still with their mothers. They're staying very close to them. They still have a very strong psychological bond. So modifying the perception of danger or the psychological stressors can actually have an impact on the immune system. So where we're going with this, it's a relatively complex area, and I was very happy to hear today a number of the speakers emphasizing the importance of metabolism or nutrition, and we've now developed, and in immunology that whole area is becoming very apparent, that the differentiation or activation of immune cells is affected very much by specific metabolites. And so now we're developing something we call a genome array, which allows us to actually analyze specific enzymes in cells, the kinases that phosphorylate signaling proteins. And so we've developed a metabolic and immune signaling genome array. And so we're now doing experiments to look at specific signaling pathways that are altered in PBMCs following exposure to individual or combined stressors, focusing on both metabolic and immune regulatory pathways. And in doing this analysis with genome arrays, hopefully this will allow us to begin sorting animals on the basis of high and low clinical innate immune responses to define stressors, and then with this analysis of our PBMCs to identify differences in cell signaling pathways, so we can start to identify at a protein level what defines an animal that actually copes better with a specific stressor versus an animal that is not able to cope with that stressor very well. And the long-term outcome of this hopefully will be that by identifying specific signaling pathways or phosphoproteins that are involved in the signaling, that these can then be used as biomarkers to quantify the impact of specific stressors and potential therapeutic targets to actually block susceptibility to BRD. So I'd finally like to just thank my collaborators, Dr. Joe Stuckey, who at the University of Saskatchewan, who's actually an animal behavioralist, and it's of huge value to take an immunologist and put him in the same room as a behavioralist. It gives us a much better context for our studies, and he's really been the impetus for us developing these models to look at the impact of stress on disease. And collaborators at VITO who have done much of the work that I'm talking about today. The clinical veterinarian, Dr. Don Wilson, who's really my eyes out there when we do these studies, and is the one that tells me when he sees things that are not typical in our respiratory disease model. And finally, the funding agencies. Thank you very much.